Welcome back. Thank you for staying with us. Local testing for COVID-19 is within reach. That is according to the director of the Ezra Long Laboratory Services during a Monday afternoon live COVID-19 update. Dr. Wayne Felicien reveals that the devices needed to conduct the tests in St. Lucia are already here. However, health officials have one more hurdle to jump over before tests can be conducted. Rochelle Gonzalez tells us more.
The days of sending tests for COVID-19 to Trinidad and Tobago are soon to end, and St. Lucia is almost all set to conduct tests locally, according to Dr. Wayne Felicien, the director of the Ezra Long Laboratory Services. This information was revealed during a live broadcast via the Government Information Service and the National Television Network. During the week of March 16th to the 20th, it was announced that the testing equipment and personnel would be ready this week. Dr. Felicien said this is still the case.
Are we now at the stage where we are able to get testing underway in St. Lucia from today or this week?
Yes, we are on schedule to start testing. Hopefully within the next 24 hours, we should be able to roll out some form of results. We have limitations due to traveling issues, shipments arriving on time, but we forecast being able to test at a capacity of probably 40 to 80 persons per day. And if you look at the weekly totals, you're looking at probably between 200 to 400 persons per week with the existing system. We're looking to do an upgrade as soon as possible, and that might bring it up even higher.
Dr. Felicien said there is still one speed bump left to go over.
When we focus on delays, we're reliant on increased requisitions for the reagents, the controls from our suppliers. So we're just looking for that to come on as estimated.
Dr. Felicien said it is only once the local testing has commenced that they can know whether there are cases of in-country transmission. Once this information is available, he said, then they can analyze the situation and then give guidance towards the future decisions surrounding the issue. Reporting for Hot 7 News, I'm Rochelle Gonzalez.
As part of COVID-19 protocol, it's now 10 people to a bus. The new protocol is not being adhered to by many bus drivers. The PRO of the Soufrière Minibus Association says drivers will not be able to make ends meet if they follow through. But a Babono bus driver says he fully understands the need for the protocol, and drivers on that stand are indeed complying. Genevieve Gonzague reports.
In a bid to ensure that the St. Lucian population practices social distancing to help mitigate the spread of COVID-19, bus drivers around the island were asked to ensure that they only carry 10 passengers at any given point effective today. The public relations officer for the Soufrière Minibus Drivers Association, Julian Snack, says that they are not very impressed with the protocol set.
The 10 persons on the bus, that does not make any sense. I would prefer they just shut down the country. Heading to Canaries is about $3.75 per person, right? So with 10 persons going to Canaries and 10 persons going to Castries, how does that work out? And with the event that you're making $80 just to get to Castries, and the extra $40 that you have, or they ask you not to pick up, what can we do? That don't make any kind of sense.
Snack has indicated that drivers may possibly stay home due to the protocol.
As a matter of fact, tomorrow I said if it ain't making sense, I would just stay at my home, because what good is it to just make $80 per head or $80 per trip to Castries? That doesn't work, and the petrol is just the same, right? And what you're making, it's best I just stay at my home and relax myself and find something else to do. Because I am a working man. I have my priorities. I've got my responsibilities. I've got my wife, my children, my grandchildren. I've got things to take care of. But what can I do?
Snack is of the view that measures are to put in place by the powers that be to aid them, as they will be making less money but will be required to spend more to sanitize their buses and purchase petrol. On the other hand, a driver on the Babono bus stand believes that we must do whatever we can to aid with the mitigating of the spread of COVID-19. Charles indicated that the public executed a good level of understanding and cooperated with drivers this morning when the protocol was asked to be followed.
Both with bus drivers and passengers, up to now we never had a problem. Nobody seemed to make an issue of it, because we all understand what we're going for and what we have to do. Protocol, disinfect, 10 per bus, we don't have a problem with that.
Charles says while he can't speak to everyone, he and a few drivers are adhering to the advisories of officials by sanitizing their buses after each load of passengers. They are also taking seriously the advice to wash their hands or use alcohol-based sanitizers when soap and water is not available. Reporting for Hot 7 News, I am Genevieve Gonzague.
The St. Lucia Medical and Dental Association is appealing to members of the public to stay home to ensure that measures to fight the spread of COVID-19 are effective. The association says people need to disavow themselves of the notion that they are not vulnerable to new coronavirus.
Practice social distancing and stay home. The information and advice is all over, but many are not heeding the message. It is a situation that has the St. Lucia Medical and Dental Association gravely concerned.
It is often said, ask not what your country can do for you, but what you can do for your country. If there ever was a time that you can do something for your country, the time is now. Stay home. Do not believe that you are not vulnerable to this virus. We are all vulnerable to this virus.
President Dr. Merle Clark says the seeking of medical attention during this COVID-19 crisis should be for more serious matters. She says these are extraordinary times and extraordinary measures must be taken.
If you have a chronic illness, call your physician. You will be guided as to what to do. If you are stable, you can be seen later on. For now, we want to deal only with emergencies, and we want to make that clear. If your prescription needs to be refilled, we will facilitate that. We are having a few glitches with our pharmacists, but we are working with all our partners to ensure in as much as possible that solutions are staying off the buses and not crowding at supermarkets or crowding anywhere.
The SLMDA president says workers, consumers, and employers all need to be on board with the implementation of social distancing.
Do not crowd the supermarkets in an attempt to panic buy. If you can work from home, work from home. And of course, supervisors, bosses, you have to understand, staying home is the only way we're going to fight this. In addition, of course, to our hygiene practices that we've been talking about a lot, hand washing, cough etiquette.
She reminds the general public that the island's healthcare system is fragile and cannot afford to be overwhelmed by COVID-19 cases.
Chief Medical Officer Dr. Sharon Belmar George announced Monday that the 311 COVID-19 response line is now available to the public. She indicated that officials are still working on making it a 24/7 hotline, but phones will be administered to all respiratory centers and physicians attached to those centers.
Our 311 line providing information to the public, as we had indicated earlier, that it would have been ready for the 23rd of March. I would like to announce and advise that it is ready and available. The hours are 7 to 7 p.m. from today. It is fully functional. We are working with another agency to extend this to make it 24 hours so that it will be a full hotline apart from those hours.
Dr. Belmar George has indicated that by the end of the day, clinical partners will be available to advise members of the public.
We will be distributing through the support of Digicel. We've received 40 cell phones, which will also form part of our response. We are hoping to distribute these phones this afternoon to our clinical partners. These clinical lines will be available to the general public that they can call at any time to get information on their health status. For example, if you live in a community, you develop respiratory symptoms, you could connect directly with a physician, and this phone will have the capacity of video. You'll be able to explain your signs and symptoms, and you'll get direct information at that time.
The CMO is appealing for first point of contact to be physicians via the phone. The public is also being urged to continue following advisories put out by the Ministry of Health as it relates to proper hygiene. This is the Hot 7 TV Nightly News. Stay with us. There's more coming up after the break.